So I'm going to talk now about optic atrophy. Now this term optic atrophy is an old term and it's used to cover the diseases of macular degeneration, of retinitis pigmentosa and some other diseases. From the point of view of Chinese medicine, it's actually a very good term because the patterns of Chinese medicine are very similar for all these different diseases. So from the point of view of Western medicine, macular degeneration is a very different disease from retinitis pigmentosa. From the point of view of Chinese medicine, it's not so different. And it's certainly been my experience in clinical practice that it really isn't that different. Of course, there are some differences, but they're not as big as you might think. The key thing is to find the Chinese medical diagnosis and not to be overwhelmed by the Western medical diagnosis. It's to use the Western medical diagnosis as another input, just as you'd use the pulse as another input. Macular degeneration is when the part of the retina, the central part of the retina, starts to disintegrate, starts to stop working. It's detected much sooner than glaucoma because being in the central field of vision, people notice very quickly when there's a problem there. Now, retinitis pigmentosa, it's called retinitis, but that's really an old-fashioned term which has stayed simply because everybody knows what it is. But in this condition, there's no inflammation. What happens is that the rhodopsin, the dye which is essential for the perception of vision, that coagulates into clumps. You can see how it's coagulated in this picture. The picture shows like little dots appearing. Well, obviously, that's a very different condition from macular degeneration. So the root cause of these conditions is something that affects the liver and kidney. It may be liver and kidney weak, liver and kidney yin deficiency, or it may be damp heat obstructing the liver and kidney, or even stagnation of blood and qi affecting the flow of the liver and kidney energy. And actually, the treatment for both macular degeneration and retinitis pigmentosa is the same in Chinese medicine. So there's no need to make this distinction. When we come to look at the patterns, we'll see that there are actually a lot of similarity in these patterns with that in glaucoma. The one that's missing is liver yang rising because macular degeneration is by its nature a deficiency condition. Its parallel in another part of the body is peripheral nerve degeneration. It's the decaying of the nerves, and the decay doesn't happen in a full condition. It only happens in an empty condition. And so the patterns that you see in optic atrophy and macular degeneration are all at root are deficiency patterns. So the patterns we've got are the liver and kidney weak, which we've already described. There's a new one here, the heart yin weak. Heart yin here means the nutrient level. To put it another way, to put it in more Western understanding way, we would say that the circulation is bad. There's not enough blood is circulating to the eyes. Spleen and kidney yang shu, well, we've come across that already. Stagnation of qi and blood, that is a new pattern. I would say it's not so common in the West. It's much more common in China for various reasons. My experience has been it's relatively uncommon to see these purple dots which you see on the tongues in China. I think the reason has to do with the relatively easier lifestyle that we have here. the relatively less repressive lifestyle. Because if you have stagnation of blood, what does that mean on a more psychological or spiritual level? Blood connects to the heart. What is it that's causing the heart itself to stagnate? Well, I can just say from my experience in clinical practice, the really full blood stagnation patterns were people who were, how should I say, extremely resentful, not resentful, bitter. They had a bitter anger and had a desire for revenge. Now, revenge, it's not that common an emotional state in the West, I would say. So, for example, I had a patient who had a motorbike accident. A car ran into him from the side and knocked him off and broke his leg in about 5 or 6 places. He was determined that the person who did that was going to suffer, was going to pay for it. And there was no way that I could get him better until the case, the law case had been finished one way or the other. And I've seen that many times since, that if a person has got this revenge, they're determined to get their own back, that's what goes with the blood stagnation. Well, as I say, it's not that common in the West. It happens a lot more in China. Certainly during the Cultural Revolution, there was a lot of injustice and a lot of people who wanted to get their own back on somebody else. On the physical level, it's some injury, something which has hit the head or wrenched the head, maybe a whiplash injury. Whiplash injury is more stagnation of qi, but it's still somewhat damaging to the flow of qi to the eyes. And then the fifth pattern we see is the accumulation of phlegm pattern, which we've seen already. So we'll see that the patterns for optic atrophy, for macular degeneration, retinitis pigmentosa, quite similar to glaucoma. The difference being that there isn't really a full condition in the same way. Just as with glaucoma, they've all got their emotional state going with them. Now, what I want to do now is again look at a case history, because it will show you how, this case history will show you how you need to use all that you have learnt in acupuncture to solve this case history, or to understand it and then solve it. So this case history is of a lady who's 57 years old. She's tall and well built, with a pale face, almost bordering on white, a distinguished and fine nose, and red lips is how you notice it. Her behaviour is quiet, with measured tones in her voice, and her main complaint is macular degeneration. It's in the early stages, and she can still read adequately, although she's noticing things going fuzzy. So that's what she came for in terms of eye conditions, but she's also got a chronic cough. She's had this for more than a year, or several years, and in the summer it gets a bit better, and in the winter a bit worse. Coughs worse when she lies down at night, although the cough's still there in the daytime too. And when she coughs, she brings up some green phlegm. Other things going on with her: she's always hot at night. She goes to sleep easily, but is awake between 1:30 and 2:30 a.m. Thirst, nothing special. Likes a glass of whiskey at night, because she was brought up in Scotland. She's always done that. Life, she's a housewife, and quite contented with that. The pulse is wiry in all positions, and it's more full and wiry slippery in the lung position. Tongue is red-purple and more red at the tip, with a hollow area just posterior to the tip. Well, this area is actually in the lung position. The tongue is peeled towards the root of the tongue. Her periods have finished now, but used to be rather painful. Well, what does this all say? It says two things. It says that there's a lung condition, the hollow in the lung area, the white face, the chronic cough. They all say lung problem. But the other thing is liver problem, the liver heat, one might say, the wiry pulse, the painful periods, the red tongue. And you can see that the liver heat is gradually consuming the yin. So the peeled tongue, the tongue is beginning to be peeled, characteristic of the yin becoming weakened. And so one can say, if you're looking down at the patterns, what have we got? What pattern could that be? Well, the first one there, the liver and kidney weak, because the liver and the kidney are being weakened by this continuing heat. What else is there? Heart yin weak? No, it's not that. Spleen and kidney? No, our appetite's fine. Stagnation of qi and blood? That could be there, but there's no history of it, there's no real signs of it. Accumulation of phlegm? Possibly, but the phlegm that she's got, it's like very obvious, as they say, substantial phlegm. Her skin wasn't especially dry, there weren't any particular signs of this thick phlegm pattern that I'm talking about. So what we're left with is the liver and kidney yin being consumed by the heat over a long period of time. But we can't ignore the fact that she's got a lung pathology, a chronic cough for a year. You have to take account of that, and you have to think, how does this relate to her pattern? Well, I think you can put these two things together. I think there are a number of different ways that you can look at it. One way is to look at it in terms of what the homeopaths call the TB miasm. Now, the TB miasm, that has no place as such in Chinese medicine. I've never heard of it in Chinese medicine. And yet the homeopaths recognize it all over the place. And one can say that it is a reality. But how do we express that? How would we express that in terms of Chinese medicine? The TB miasm, which they talk about, we would describe as a metal-wood imbalance. So when it's at the miasm stage, the very nebulous stage, it's just a metal-wood imbalance. When it's actually at the physical level, it's closer to liver and lung imbalance. So the lung is over-controlling on the liver, or the liver is insulting the lungs. So this is certainly going on in this person's life. I mention this because it's actually an extremely common pattern of this wood-metal imbalance. It's commonly seen, in my practice, I should say, in Britain, one could say it's common. So that's one way of looking at it, this imbalance, and to think that you can clear the liver heat without addressing the metal problem, without addressing the lungs, is erroneous, because there's this tension between the two, and it's resolving the tension of these two which you need to do. To put it another way, look at it from another perspective, we can say that the lung aspect of it, the metal aspect of it, is like the dreaminess, that they're not actually being present, because that's a characteristic of metal. And this person, she was brought up in Scotland, on an island off Scotland actually, and part of her was, as the song says, over the seas to sky. That was what she was dreaming of. And yet at the same time, she didn't want to go back there. So to ignore the metal side of it would be, you wouldn't get very far. So you need to treat the metal on the one hand and to clear the liver heat on the other hand, because if you don't clear the liver heat, it will go on consuming the yin. She's just at this transition point between a full liver pattern and an empty liver and kidney pattern. And so this is why she's just beginning to get this deficiency condition. What do you do here? Well, I treated liver 2, liver 3 again and again and again to clear the heat. Why didn't I tonify the yin? Because I felt she still had enough strength for me to do dispersing treatments. She still had enough strength. And each time I did the treatment, it calmed her down a little bit and the heat gradually reduced. So I did liver 2, liver 3, lung 10, because this heat was also affecting the lungs, lung 10 and lung 5. At times when the cough was very bad, I would do points on the chest also. And gallbladder 20. In her case, I didn't actually do points on the eyes, around the eyes itself. Perhaps I should have done, I don't know. As it turned out, she didn't need those points. That the treatments, over a period of time, it took quite some time. It took about a year altogether. Not continuous treatment for this time, but that's the time that it took for the changes to take place, for this heat to go, for this tension between the liver and the lungs to reduce somewhat. Now, it'll never go completely, because that's something to do with her nature. Is this tension between the wood and the metal is her nature, but it went enough so that this tension was not causing damage to her. So that's an example of macular degeneration, how quite simple treatments, not even using points round the eye, were helpful in treating it. But actually you had to think a little bit more than what are the patterns. The patterns give you the clue as to really what's the cause. And in this case it was the liver and kidney weak is the reason for it. Then you have to think, what's causing this liver and kidney to be weak? Well, it was being consumed by the heat, which had been there for many, many years. In this particular patient, the macular degeneration was only mild. It was caught before it had really taken a hold, and at the end of treatment, it was completely cured. And this is really a possibility for if you can catch macular degeneration in the early stages, and you've got a patient who still has a reasonable amount of energy, enough energy for some amount of healing to take place. If the macular degeneration has progressed further, and there are very significant areas where the vision has gone, if there are very significant areas where there's loss of vision, then it's unlikely for these to come back. What happens in these patients is that you can get some improvement, some minor improvement, so that the macular degeneration, rather than getting worse, gets just a little bit better. But generally speaking, in all retinal problems, if there's been loss of vision, if there are blind spots, and they've been there for a significant length of time, shall we say more than 3 months, it's unusual for the sight to be recovered in these areas. So it's like a numbness, a paralysis. Once the paralysis or the numbness or the deadness of the nerves in the eye has been there for a long time, 3 months or 6 months or more, then it's unlikely that the use will return. It's unlikely that the sight will return in these areas. So what one can hope for is to stop the macular degeneration in its tracks and get just a little bit of improvement, a slight sharpening of the vision. So how many treatments does one need to give in the case of macular degeneration? Well, this is always a difficult question to answer in the abstract. But my experience has been that the first step is to clear the underlying imbalance. So in the case of this lady with the lung problem, it took quite a while. It took 6 months to significantly change the underlying imbalance. Once the macular degeneration has started to improve, and once the underlying body condition has changed, then treatments can be spaced out. But during the early stages, I normally give treatments about once a week. I have to say, this is how I do it, and this is something that's grown up out of my individual practice and the way the rhythm of my work works. There are other practitioners who do it somewhat differently. For example, there is a Dr. Boel in Denmark who treats people very intensively. He'll treat them twice a day for the first 2 weeks, and he'll treat them once a day for the next 2 weeks in order to make a very big impression very early on. So there are different styles of treatment, and the different styles suit different practitioners and also different patients. The attraction of Dr. Boel's method is that you can give up a month of your life, go to Denmark and get it fixed and then leave it. The attraction of my method is if you live somewhat closer, if you live within a 10-mile radius, that means you can come every week or perhaps twice a week, and you can be much more relaxed about it. I'd like to say a few extra words about macular degeneration from the point of view of Western medicine. According to Western medicine, there's 2 types. There's the so-called wet type and the so-called dry type. And although the symptoms are very similar, namely that you get this progressive blindness in the macula, in the central area of vision, the cause of it is somewhat different. The wet type is thought to be mainly due to fluid accumulating behind the retina, between the choroid and the retina. In this picture here, which is a tomogram, you can see a cross-section of the retina. The first picture here is a relatively healthy one. And in this next picture here, you can see that there's this big lump. The retina is being pushed out, and you can see how this could easily lead to malnourishment of the retina. And so in the past 10 years or so, a treatment has been developed for this, which is to inject the eye with a drug it's an astringent drug to dry up the fluids there. And this has been partially successful in helping people to retain their sight. Of course, the drawback is that the treatment needs to be repeated again and again, so it may need to be repeated every 6 months to a year. And at the present time, they don't like giving this treatment to younger people. In the older patients, they say, well, there may be side effects, but at least you've had some extra years of good vision. But in the younger patients, they don't like to prescribe it because as yet, the side effects are unknown. The long-term side effects of this are unknown. So there is at least some treatment for the wet type of macular degeneration. And it's a matter of opinion, a matter of judgment in each individual case, whether you should give this treatment before or with the acupuncture, or whether you wish to rely on the acupuncture alone. This is, of course, a matter, as I say, of individual judgment. And what's the basis for the judgment? Well, it's up to the patient to decide. There are many patients who actually are very fearful of having a needle stuck directly into the eye, because this is what the treatment involves. It involves, the treatment is a course of 3 injections directly into the eyeball. I would like to add that if your patients do decide to undertake this, then you can reduce the pain which they experience in two ways. First of all, there's the acupuncture by bringing qi and encouraging the free flow of qi around the eyes. So if you can give a treatment like the day before or even the day of treatment, the day of their injection, then this will help to reduce the pain that they might experience, the post-injection pain. The other treatment is to give the homeopathic remedy Ledum. You might think that arnica is the remedy of choice, which is the one normally given before operations, before and after. But Ledum is specific for injury due to sharp objects, such as a needle, and of course such as the pain you might experience due to having an injection. So what should you do as an acupuncture practitioner about the wet type? Well, the wet type, you should do the analysis in the terms that you know. As I said at the introduction to macular degeneration, that it's part of the class of illnesses called optic atrophy. And so you need to do the diagnosis on the basis of differentiation of syndromes, decide which one is most important, and then treat accordingly. You might think, well, what has the syndrome of blood stasis got to do with accumulation of fluids? Well, a moment's reflection and you will remember that if you are injured by something, if you have a blow to any part of the body, what happens? You get swelling, you get local accumulation of fluid. And so the same is true for an eye disease. If you get local accumulation of fluid, this may be due to an injury to the head. In fact, just recently I had a person who had exactly this pattern. They'd had an injury to the head, they were hit on the head quite hard, and then gradually the macular degeneration developed. And the reason why it developed was partly because they were old and so the kidney energy was declining a little bit, but more importantly there was blood stagnation, general blood stagnation due to slight weakness of the heart. And this could be easily seen on the tongue by a slight purpling colour of the tongue. So I would say in this context, don't be blinded by science. The pictures that you can see, the techniques for obtaining these pictures are really quite extraordinary. Even as little as 10 years ago, this technique of tomography for the eyes had not been developed, and so you couldn't get such extraordinary pictures, that picture of great clarity of a cross-section through the eye. And now you can. It's easy to think, oh, what can I do about that? What you can do is what you can do, which is to do a diagnosis on the basis of Chinese medicine. It might guide you. It's helpful. It's helpful in perhaps prescribing herbs, because if you know there's fluid collecting, then that's a pointer to the treatment that you might give, the herbal treatment. You might give treatments which are more aimed at draining fluids and circulating fluids rather than any other treatments. So that's the wet type of macular degeneration. In the dry type, the macula degenerates simply because you have nerve degeneration. And so that is very similar to Wei syndrome. It's the same pattern as peripheral nerve degeneration, when people get progressive numbness and paralysis in their legs. The cause is the same, and it's due mainly to kidney weakness, liver and kidney weakness, but also combined with damp heat. So once again, don't be too overwhelmed by the diagnosis of is it wet or is it dry? It can happen that you treat the wet pattern and it turns into the dry. So do the diagnosis on the basis of Chinese medicine. That's the medicine that you're using. I would just like to say that earlier in the year, I had a patient who with wet type of macular degeneration, and I gave her a treatment, again on the basis of Chinese medicine, and within a day her eyesight was already significantly better, and within 2 weeks it was much better.